Welcome to Ask Dr. Louise. Keep following up. Are you navigating the dilemmas that addiction, aging, and mental health issues present? Ask Dr. Louise is the place to start. Life is often a series of hiccups, and while you might get knocked down, you always have the opportunity to fall up. Addictions and mental health issues are not a life sentence. There's always hope and strategic solutions for helping you become a better version of yourself, while impacting your loved ones with grace, compassion, and integrity. Join us as we navigate how to have those uncomfortable yet necessary conversations with yourself and your loved ones to take the actions needed to help you rise to be your best possible selves. Get ready to walk away with doable solutions? Ask Dr. Louise starts now.
Hi, good afternoon. I am so excited. This is actually the inaugural launch of Ask Dr. Louise, and I could not be more excited because I have one of my most favorite, most talented people in the entire world, Dr. James Flowers of JFlowers Health Institute, as my first guest. Good afternoon, Dr. Flowers.
Dr. Louise, I am so excited to be here. I cannot believe I'm guest number one because this is going to be so amazing and you're going to do fantastic on this show. And I can't wait to watch your listener audience just grow and blossom because I know it will, because you do teach people how to fall up. So thank you.
Well, thank you. I guess maybe I want to introduce you a little bit, but I've had the pleasure of knowing Dr. Flowers for well over a decade. And we met, of course, we're both academics, and we met, of course, at a conference.
Yes,
and immediately was sort of smitten with his academics, with his vision, and with his ability to create integrated wellness solutions. So maybe you could start just by telling us a little bit about yourself and a little bit about JFlowers Health Institute.
Yeah, absolutely. So first of all, again, Louise, or Dr. Stanger, I should say, thank you for thank you for having me. I'm excited to be here. I cannot believe it. I was doing a podcast earlier today and she asked me how many years I'd been in practice. And when I said 32, I almost fell out of my chair. And I was like, my gosh, I can't believe I've been practicing for 32 years, a combination of academics and practicing. And that's just wild to me. But over those 32 years, my role has been, I'm an academician at heart. I'm a scientist. I'm a researcher like you. And you and I really like to look at the human condition, lives, mental health, addiction from really a scientific basis, right? And we really like to hone in and be precise at making sure that the way in which we work with our clients is the right way. And when I mean the right way, I mean, you want to get them to a location where they're going to be safe, secure, and have excellent treatment. And I want to provide safe, secure, and excellent treatment through my practice, JFlowers. And what I've noticed over the last 32 years, a number but that the US government always gives out to the public on SAMHSA is, it always freaks me out. And it says that over 70% of people who go to treatment relapse. That's pretty darn high. And I think that is unreasonable and it's not okay. And what I've seen and what I believe one of the biggest problems in the United States is that when you are admitted either on an emergency basis or a volunteer basis to a mental health program, you're often seen, or you are seen, by a psychiatrist. And a lot of times in 2024, that psychiatrist is on a little screen in front of you, and the patient is sitting there, and the patient is nervous and afraid, or possibly psychotic, or high sometimes, and the psychiatrist asks questions, and the average diagnosis of a patient is given within about 6 minutes. And the preconceived diagnosis that a psychiatrist will give And then that psychiatrist will pass a diagnosis off to a nurse practitioner, a nurse, an LVN, a tech, a therapist, a social worker, what have you. And everyone goes off of that preconceived diagnosis. And medications and prescriptions are written based on that 6-minute thought of that diagnosis. And I believe that's why we have a 70% relapse rate, is we're often misdiagnosing individuals, and we're often mistreating individuals because we're not taking time, or many people are not taking time to really understand the person with whom they're sitting with, right? And there's various reasons for that. One is time. The psychiatrist's time is valuable. A psychiatrist's time is short because there's so many patients trying to see them, whether it's Los Angeles, Houston, New York, Miami, Atlanta, Boston. The average wait time to get into a psychiatrist is 8 to 12 weeks. That's not okay either.
Yeah.
And so we're seeing all these diagnoses that are incorrect, all this medication that's incorrect, all this treatment that's incorrect, and people get treated and then they go home and relapse, whether it's an addiction or whether it's a mental health crisis or whatever it is, because insurance and private pay, is such short-term treatment. And what we need to do is lengthen that treatment time and really spend more quality time with the patient to better understand. And so that's one of the reasons that I really wanted to build JFlowers Health Institute, because we take our time and we're extremely precise with diagnosing and giving the correct diagnosis. And it takes weeks for us to come up with the proper diagnosis, not 6 minutes.
I know. And that's what I love about you, because both of us love what is called the triangulation of data. So I always interview everybody individually. It takes 60 to 90 minutes when I'm doing something. But what I love about you is it's not a one-shot 6-minute deal. Clients or patients that come to JFlowers, they are evaluated by a psychologist. They are evaluated for trauma. They're evaluated for brain mapping. I mean, I can't give all the wonderful things that you do, but they're seen in totality. And the same thing with their family. Their families are interviewed individually because everybody has a voice. And once you put together, I always think it's like a kaleidoscope or creating a tapestry. And there you really can honor this client or this patient and really say, this is what I've learned, this is what I see, and this is some of the solutions that are there for you. And
Right.
to me, that's really exciting, which really leads me to, what do you think the state of behavioral health care is today? Because what we see is the good, which is really JFlowers Health Institute. It is great. I love the Plato talks about thoughtful consideration and wise deliberation. And I've known you long enough to know that's what you do. And it does take time. And people sometimes say, why not? Why?
Yeah.
So long, but it's not an instant fix.
Right.
But we've seen so much in our industry that does a disservice.
That's right. And likewise, coming from an academic background, I love the way in which you do that triangulation of data, because oftentimes people want to do an intervention very quickly, and they call it an emergency and they say, it's 3 o'clock. Can I meet you at 6 for an intervention? Can you? And I know you say, no, there's a process here. And I've seen you interview multiple family members and gathering that data. And it's almost like a qualitative study where you take that data and you take each person's story about an identified patient or identified person, and then you put it together and create your own vision. And then you meet with the family and meet with the people and the identified person and get them into treatment. But without having that accurate information, I think that we're not able to properly place people, and then we're not able to properly diagnose and treat people. So I think it starts with the family reaching out to people like you who are well educated and trained interventionists, and then interventionists understanding the programs that they like to refer to because of the quality and time they can spend with patients.
And I also think it's so worthwhile to have the due diligence for someone to be able to understand another person, to have that sort of luxury. And most of the time, 97% of the time, you're also changing that family system.
Yes.
And by family system, I can mean not just family of origin, I mean the politician and his staff, the CEO with his staff, the celebrity with her hairdresser, all the different people. And that's what I really love that you do. But let me ask you a question because you're just really on the forefront. What would you say are the top 3 issues today in behavioral health today?
Oh my gosh. I think the top 3 issues in behavioral health today, and when you say issues, do you mean concerns or yeah, yeah.
Concern.
Yeah. I think the biggest issue is the fact that we're still living with the remnants of a world catastrophe being COVID. And people are still living based on trauma from being sick, not being able to work, doing the things that we went through during COVID. And there are lots of people experiencing long-term COVID effects that cause emotional distress and depression and anxiety, that cause physical symptoms. I think that's one thing that we're seeing. I think that we're seeing a huge number of trauma patients these days that individuals are really coming forth now and showing that they're willing to get help for trauma that has been unresolved and that has caused difficulties in their relationships and their marriages and their lives with their children because they haven't resolved their own trauma, and then now they're willing to get help. So I think those are 2 of them. And let me think. And then of course the third one is my core science and passion is working with people with chronic pain, which is a physical symptom, but the emotional effects of that physical symptom are huge. And we're seeing, because of the opiate crisis, we are still seeing huge numbers of people that are still wanting or needing to detox from their opiates and learn how to live with their chronic pain without medication, but learning to live and thrive with their life, learning cognitive behavioral through cognitive behavioral therapy and meditation and mindfulness, and learning how to accept their chronic pain and move forth and thrive. So those are 3 topics.
So I really loved, I'm just gonna hit on 2 of them because I know that they're one. I have recently written a controversial article which says trauma is the most overused word in the country. And it's
Yes,
not that, I think that what I really love is, especially I know you do this in your diagnosis, is taking a look at people's lives and what has happened, and whether that's a sudden death, whether that was a chronic illness, whether it was a move across the country, whether it was a parent being emotionally unavailable because of something else taking them away, and whether or not it was too much screen time. But there's so many different things. So when we talk about trauma, and I love the fact that I know you do a trauma history and a trauma timeline, that we are able really to identify what does that mean and what are we saying? Because being able to take a look at those incidents and then also taking a look at one's resilience.
Right.
Because resilience is sort of key with that. And obviously, we know in a COVID-ridden world that we have created, or COVID created, so much anxiety in different ways. We've got more screen time for little kids. We had an increase. There's an increase right now in alcoholism for women under the age of 40, which really started during COVID because they didn't know how to raise their children. I remember when I was on Katie's podcast,
Yeah,
Works podcast, women did not know what to do with their kids at home. We didn't know how to teach math or anything, so they would have cocktail parties.
absolutely.
And so doing all these things and suddenly being forced, it is so beautiful that you're taking a look at that. The other area that you are such an expert at and is chronic pain. And I've had the privilege of having knowledge about some of the clients that you have worked with or I have worked with, and you can see how chronic pain, how trauma impacted them or how the chronic pain impacts them. I always remember a wonderful woman who, I don't know why she came to mind. We have so many clients, but if you remember a long time ago, there was a woman who was stealing all the prescriptions from her dentist's husband.
Yes. Yep.
And she steal them. And
Yep.
she had shoulder replacements, she had knee replacements, and she just couldn't walk, couldn't talk, and she got arrested. I think that's how she ended up at one of your facilities. And yet her goal was to somehow or other to go to a daughter's wedding.
Yeah.
And all the magic in the world, you could talk about all the EMDR, all the DBT. It's really a testimony to how you started where this client was. And it wasn't you and it wasn't me. It was the fact that when she was younger, she liked to go out on a canoe. And one day there was a chance for her to go out into the lake on a canoe ride. She went out there and something snapped. And from there, and I know our readers just think, what are you talking about? But when you join up with a client, and what I love about Flowers, what I love about the work you do, is you've got to start where that client is, and you've got to go like Sherlock Holmes
That's
and
right.
unlock that magic. And for her, it was this canoe ride that reminded her of what it was like as a child.
Yeah.
And the joy she had that gave her the courage to learn the CBT, to take a look. And actually, the moral of the story was really successful. She was able to go to her daughter's wedding, and she was able to walk around this facility for about 3 miles when she never could before.
Do you remember when she first came in? She could barely walk. She was very quiet with her voice and very tearful, did not want to be there, but was willing to do it because of the daughter's wedding. But she said, this isn't going to work, right? It's her belief system was it's not going to work. But that canoe trip, you're exactly right. That canoe trip, something happened in that boat. I call it a God shot, right? It was her
Yeah.
spiritual awakening happened in that boat. And she came back from that boat trip and was so excited. And really from that point on, she really participated fully and was actively engaged in her own treatment, her own wellness, her own really she looked outward and inward at herself and said, I will do whatever it takes to go to my daughter's wedding. So that was an amazing, such a great success story for us that you and I got to share.
Yeah. And I think what I really think about is when we think about how can we help people, how can our listeners have, really what we're talking about is building architecturally a blueprint for success.
Yes.
One that capitalizes on self-efficacy, one that looks at the strengths, because literally it's real easy to go to the weaknesses.
Yeah, it is. I was just telling someone today that when you sit at a public restaurant or a public park or a park bench or wherever you are, and there's public people around you, if you just close your eyes and listen to the conversations, 90% of them literally are negative. And they are complaining about something or talking negative about someone or talking negative about something about their day. You rarely hear people in public at a restaurant or anywhere talking about really fun, happy, how was your, oh my gosh, it was wonderful. My boss was fantastic today. I had such a good day. It's usually my boss is driving me crazy, et cetera, et cetera. My children are this, my husband is this, my wife is this. And it's, I don't know that it's easier to be negative, but it's certainly more prevalent to be negative. And so what we like to do is really say, let's have that paradigm shift and we'll meet you where you are, but we're going to change that negative thought into a positive thought process.
And you would like that today I met with a family, a mother and daughter, and usually they talk so much I can't even get a word in edgewise. Was it really? But
I don't believe that for a minute.
I know, and I love that. I asked them, I invited them because we can only invite clients using. I said, do me a favor, we're going to take a 10-minute break now. You are each going to write down 10 things that are positive about each other with examples, and we're going to give it. And they went, what? And I go, yes. So there was silence for 10 minutes. And then they said, well, we need some more time. And the same thing you do with a family, a child that,
Yep,
whether it's a young adult or something else, because everybody is so intent on what is wrong. But we've got to start with something that's going right. We can go
that's right.
backward.
Yep.
And to me, that's one of the most exciting activities to do. And everyone looks at you like, what, pardon me? Do you
Yeah,
really want
exactly.
me to say that?
Even if you're working one-on-one with an individual and you say, write down 3 positive things about yourself. Oftentimes, as clinicians, you and I both get to go look at them and say, write something, 3 positive comments. And they're like, I have no idea what to write.
Well,
And isn't that sad?
it is, because we always like that's like the morning that we start out with doing, Edmonds, who's the positive psychologist that was with Siegelman, says, well, we should start out the day by writing a grateful list.
Yeah,
And what we're grateful for, or what we've been, or at nighttime, what we're successful for. But you got to share it with someone else. Because if you
that's
keep it
right.
all to yourself, it doesn't work.
Yeah,
Well, you are so well renowned, and I know you've been doing a lot of work with integrative wellness, lifestyle wellness. I mean, what are some of the things that you would like this audience or listeners to know? And I really want them also to know how to get in touch with you.
sure, absolutely. So my thought process and really my academic background and training really tells me that whether it's a medical condition, a psychological, a psychiatric, a addiction to substance uses or anything else, or it's a unknown condition, that what we really need to do is work as a collaborative team, really working in a 360-degree circle, evaluating every single component. You and I would call that biopsychosocial, right? The biopsychosocial model of health means we're going to look at the biology, the psychology, the social, and everything else about you in a 360-degree, head to toe, inside and out. And so they do, when people come to us, they have a full executive health and wellness physical, including lab work and diagnostics such as MRIs or CT scans, if necessary. They do a psychiatric evaluation, not a 6-minute one, but maybe a 2 to 3
Yeah.
hour one.
You
They,
know what? We don't have a lot of time yet, but
yeah.
I wonder if you could tell them a great story.
Oh my gosh.
True story about the wonderful gentleman who came to you and there was something behind his ear.
Yeah.
Can you do that one? Doctor, I mean, for those of you that don't know, I call Dr. Flowers Sherlock. Why? Because he's like Sherlock Holmes. If you don't know what's wrong, he can discover it. So
That's
a little bit of time left. I think people need to see your genius.
yeah. Dr. House, maybe sometimes people call me Dr.
Oh,
House.
maybe Dr. House.
Or
I'm
Sherlock
older,
Holmes.
so
Yeah.
I go for
Yeah.
Sherlock.
So in our few minutes left, this 71-year-old gentleman came to me with a problem of dizziness and chronic fainting and could not figure out why. And his family thought that he was an alcoholic when he had really never had a drink in his life. He had only been drinking recently in the last 2 years to allow himself to fall asleep because of this condition. And they had spent literally a few $100,000 at different medical institutions around the country trying to diagnose him, and everyone diagnosed him with a psychosomatic disorder or somatoform disorder, meaning there's really nothing wrong with him. But after about 18 days of evaluation, we learned that this man, through spending time in a collaborative effort with him, with neurologists and psychologists and neuropsychology and myself, and an entire team would interview him for hours a day and work with him. And we figured out that he had gone to a dentist 2 years early and had a molar had been pulled from an abscess. And the neurologist said, I know exactly what's wrong. went to Methodist Hospital here in Houston, did an MRI of the back of his brain. And what had happened is when that dentist pulled that molar, the occipital nerve, which runs from here to back here, came loose and it wrapped around the medulla of the brain, causing him, every time he moved his head to the left or to the right, that nerve would tighten and cause him to get nauseated, dizzy, and fall over and pass out. Not because he was drunk, because the nerve is not supposed to touch the medulla of the brain. And so we did a very small keyhole incision, moved the nerve off the medulla of the brain, put it back into its proper place, closed it up. And today he's 74 and riding horses and having an amazing life. But he literally had been misdiagnosed by so many people around the country and as having somatoform disorder or psychosomatic disorder. And he really did have a medical condition that was greatly affecting his psychology and his depression and his anxiety. That was a very easy fix, but it took us even 18 days to figure that out.
It was such a good outcome, and it just shows the due diligence that you all do. Well, people want to know how to reach you, and where are you speaking next, and how can they just read more about you?
So JFlowersHealth.com is our website. So please go look at JFlowersHealth.com. Speaking next, I would have to ask my assistant where I'm speaking next. I'll find out and get back to you guys on that. I really do not know. That's horrible. I didn't know you were going to ask me that question.
Oh.
And I think in the 2 minutes that we have left, the name of this show is Ask Dr. Louise. So I want to ask Dr. Louise, what is your favorite thing about being an interventionist?
Well, I think it's really two things. It's helping change families. I think that everyone thinks that your job is to get the identified loved one into treatment. But the most exciting thing is watching and creating a complete change in the entire family. I talk about it as riding a bicycle backwards, because families we're all used to doing this thing, and now suddenly we have to do this thing. But I love the notion of the inquiry, which is very similar. And I love working with however you choose to define family, because to me, I'm really passionate about creating that kind of change. I think once upon a time, someone helped change my life. And if I can be of service in that way and work with people, and by the way, intervention to me just means an invitation to change. And I think every day in every way at Flowers or whatever I do, we're inviting people to change and giving the opportunity for success.
Thank you, Louise, Dr. Louise, for having me on. This was amazing.
Well, thank you, Dr. Flowers. My heart is full, because once again, we are off, and I can't wait to see you again and hear where you're off to next, whether it's London, whether it's Florida, whether it's San Diego. Oh, wait a minute. We are going to see each other because we both support the same charity.
Yes, very soon. Well, I'll see you in LA at Miriam.
I'll see you in LA. Okay. Thank you. Okay. Bye-bye.
You have been listening to Ask Dr. Louise. Keep falling up. Tune in every fourth Wednesday at 12:30 Pacific Time on Transformation Network for more fresh takes on addiction and mental health that help you and your loved ones to keep falling up. We navigate how to ask yourself tough questions and how to have those uncomfortable yet necessary conversations with your loved ones. Ask Dr. Louise helps you gain resources to take doable actions. For more on the most advanced health and wellness solutions, visit allaboutinterventions.com.